Good evening. Welcome to the Lupina Center for Spirituality, Healthcare, and Ethics Fall Lecture with Daniel Sulmasy. My name is John Berkman, and I'm the director of the Lupina Center and also a professor of moral theology here at Regis College. Our speaker tonight is Dr. and Brother Daniel Sulmasy, medical doctor and Franciscan brother. Dr. Sulmasy grew up in New York and did his medical training at Cornell and at Johns Hopkins, and did his philosophy doctorate at Georgetown University under Edmund Pellegrino there. Dr. Sulmasy has written a number of books, including The Healer's Calling from 1997, The Rebirth of the Clinic, 2005, The Balm of Gilead, which is around 2009, I can't remember that exact date, and he has a new book coming out from which he will be speaking one of the chapters of that book. His address will be one of the chapters, and the book is Sacramentum Medicinae, excuse me. Sorry, my Latin is not very good. And Medici is quite another thing. And his lecture title tonight is Spirituality and Health, Lessons from Fred. And interestingly, a few weeks ago, we had somebody email us and said, is there a typo in that title? Is it supposed to be Lessons from Freud? And we thought, well, as Dr. Sulmasy said, that would really be quite an accomplishment if he could do something on spirituality and health lessons from Freud, but he is not going to be trying to do that. Instead, he will be giving us lessons from Fred. Now, just before I ask you to welcome him, I'm also going to hand out feedback forms, so please take one of those, and we'll be most grateful at the end of the evening if you will please fill out a feedback form and hand it in. But right now, please welcome Dr. Daniel Sulmasy.
Thanks, John, for that very gracious introduction. Thanks to all of you for coming tonight. A few caveats before I start. That while this is a center for spirituality and ethics in medicine, this is going to be mostly spirituality tonight, not really ethics. And it's going to be, in some ways, a presentation of spirituality rather than about spirituality. I'm not going to be talking about spirituality so much as trying to share something spiritual with you. It's intended in some ways to be mostly for physicians, but I think that there's a broad enough sense about it that everybody, particularly who's concerned about healthcare and other healthcare practitioners, can get something out of it. It's necessarily going to be personal. And I think that's because if we're going to do spirituality, it's only persons who can wonder or help other people or love or pray. And it's therefore also going to be very particular. So it's going to be Christian, Catholic, and Franciscan. And that's not to exclude anybody, but it's my own sense that the best kind of interfaith spirituality is done when a Jew speaks as a Jew, a Buddhist is a Buddhist, a Christian is a Christian, and that if we do that authentically, that there are resonances, if we get down to a deep enough level, that cut across all those traditions in ways that are helpful for all of us. So with that being said, as all of my caveats, basically, for the next 45 minutes or so, I'm just going to tell you a story. The names, I will say, this is the ethics part of it, the names have been changed. All right? Fred is not Fred. But I'm just going to tell you a story. In the end, I would fail him. It was as inevitable as the rain. I knew it from the beginning. See, I was the ethicist on call for the second week of November. A nurse called me and she said a patient wanted help with an advance directive. And I waited till the end of the day after first attending to emails and some editing, and then I trudged over to the hospital to the cardiac step-down unit. Not too many requests for living wills here, I thought to myself, knowing that cardiologists don't actually believe that their patients ever die of heart disease, only that they sometimes might succumb to comorbidities like diabetes, or else they died when the code was called off. And in the latter case, of course, it wasn't heart disease, but rather the failure of technology that really did them in. In any event, it was just plain unusual to have a patient on a cardiac floor ask for help with an advance directive. But otherwise, it was a routine request. I would just take a few minutes to explain the difference between a living will and a healthcare proxy, and recommend that the patient execute a healthcare proxy without letting him know why. And then I'd leave him with some blank forms and be on my way. Usually, actually, in our hospital, this kind of task is left to patient representatives. Sometimes, however, the patients insist that it must be the ethicist with whom they speak, and I was happy to serve the patient's request if that's what he wanted. In fact, I had done the same the week before in the medical intensive care unit. You know, it wasn't going to be a full-blown ethics consult with a dilemma or some disagreement or some other knotty problem. The request seemed routine enough that I didn't even bother to look at the patient's chart before I entered the room. Mr. Fred Finnerty, I inquired. He nodded his head. He looked a bit disheveled. He was obviously frightened. He was 64 years old, on the short side, a bit overweight, mostly bald, with a snow-white, untrimmed beard. The places where the razor should have cut his face back to the bare skin were peppered with a gritty white stubble. His voice was unpleasant to hear. A strong New York accent combined with a whiny lilt. "I know who you are," he said. "You're that Dr. Sulmasy. I met you after a lecture 6 months ago, you remember? We invited you to talk at our chapter of the Sarah Club, you know, that group that promotes vocations to the priesthood." I had only the vaguest recollection. "Oh, yes, I remember. Good to meet you again. I understand you want help filling out an advance directive." "I got lung cancer, you know." No, I didn't know that. I actually didn't look at your chart." "Would you be my doctor?" Excuse me? "I heard you lecture, and I said to myself, if I'm ever really sick, I want that Sulmasy." Now, he spoke so earnestly that his head leaned forward on his neck, and his eyes seemed to strain forward out of his skull, each held in place by its optic nerve, the way a leash holds a dog in place upon meeting another dog. "But you have doctors caring for you now, don't you?" I said to him. "Yeah, but they're for my cancer and my atrial fibrillation. I need a regular doctor. I know I can't be cured. I need a doctor for when things get bad. And I don't want no feeding tubes or nothing. I'm a Catholic, and I don't want anybody telling me I gotta have one. I trust you." Now, this actually is one of the problems that accompanies the giving of public lectures. If you sound sincere, people believe you. They might even believe in you. And if they do, this forces you either to try to live up to their expectations or avoid getting involved. Sane people avoid such situations. Doctors, known for their outsized egos, just climb right up onto the pedestal and pose. "Sure, I'll be your doctor. Let me just go back to the nursing station, read your chart, and come back, and I'll talk to you and examine you." That's how it began. He had metastatic non-small lung cell cancer. He'd been diagnosed in September. It was now November. He was receiving Tarceva, a relatively mild anti-cancer drug with some activity against lung cancer. He was also undergoing radiation treatment to a painful bony metastasis in his right shoulder. He was admitted with fever and cough, possible pneumonia. His blood was also, quote, very thin, unquote, a consequence of an interaction between the Tarceva and the medicine he was taking to prevent blood clots and the strokes associated with atrial fibrillation, the disturbance he had in his heart rhythm. "I'm gay, you know," he said as I was listening to his lungs. I had already surmised as much. "And an alcoholic. But I go to meetings. I've been sober 25 years. I'm a friend of Bill's." "One day at a time," I said. "Yeah," he replied. "Now take a deep breath in while I examine your belly." "I know a lot of priests, you know." "Oh, really? Where from? AA?" "You know, I can't answer that for you." His heart had been beating too quickly when he was admitted. The cardiologists were giving him medications to slow his heart rate, but one of the side effects was that it was lowering his blood pressure. He couldn't stand up without becoming dizzy. Complicating matters, he was having side effects from the Tarceva, a rash and diarrhea. The diarrhea had caused him to lose large amounts of body fluid, making his blood pressure even lower. A couple of liters of normal saline did the trick. His blood pressure came up, his heart rate came down, and after a week in the hospital, he could finally go home. When I saw him in the office 5 days later, he wasn't doing well at all. His blood pressure was still lower than I wanted it to be, and his heart rate was still too high. He was nauseated from the Tarceva, and he was still having diarrhea. I tried to get him to take in more salt, you know, soups, crackers, pretzels. "You've got to keep up with your fluids," I urged him. He was also short of breath when he tried to walk. His oncologist blamed it on his heart. I thought it was all the nodules of cancer in his lungs. The oncologist also thought the Tarceva might be helping him. Having looked at Mr. Finnerty's x-rays, I found it hard to see how he was drawing such a conclusion. I sometimes have to wonder who is more likely to be in denial, cancer patients or their oncologists. "Here's my healthcare proxy form," said Fred. "I named Father O'Malley. He's a good friend of mine." "Thanks," I said. I'll put a copy in the chart. If we need it, now we know who we can call." "I want to go to St. Clair's Hospice when my time comes," he said. "I don't like that Mount Carmel. They were not nice to a friend of mine. He wanted to go out on passes and they wouldn't let him. They were like the nuns in my grammar school. So much attention to law and order, they lose sight of the big picture." "Okay, Mr. Finnerty, I understand, but you know, it takes a long time to get into St. Clair's. They're always running full and there's a long waiting list." "I can wait. I do live alone, but I cashed in my life insurance and I can use my IRA. I got aides coming to the house and I can get them round the clock if I need them. The nurses come 2 days a week and the physical therapist 3 times. I think it would be easiest to just stick with the home nursing service till a bed opens up. But if the list is long, why don't you just put me on it right now?" "Well," I said, "let's wait and see what the oncologists say about the Tarceva. You know, it might stabilize your disease and give you more time. We need to say, you know, that you have 6 months or less to get you onto hospice." Actually, I really believed he already was eligible for hospice, but this was the first patient I had cared for who was being treated with Tarceva, and I didn't want to challenge the oncologist with my limited knowledge and experience. And I didn't want to undermine the oncologist's message to the patient. Not only did I say what I did to protect the patient from a dispute among his doctors, but it was also because I was something of an interloper. The patient had brought me into his care right under the nose of his oncologist. The oncologist might be worried that the ethicist was stealing his patient away from anti-neoplastic treatment into the world of palliation. And so I decided just to parrot the oncologist's line about needing to wait a few weeks to do a CT PET scan to see if the Tarceva was working. 2 days later, Fred saw the oncologist, who immediately admitted him to the hospital. The nausea and the vomiting about which he had complained to me had worsened. He had become more dehydrated and had nearly fainted. His blood pressure remained too low, his heart rate too high. The Tarceva was stopped, and he received intravenous saline once more. His nausea dissipated and his blood pressure came up. We discharged him on a lower dose of Tarceva to see if he could tolerate it better. 2 weeks later, in the face of more nausea and diarrhea, it was clear that he wasn't tolerating the drug at any dose. I decided he was really too sick now for me to have him come to see me in the office, so I'd start making house calls instead. Will they give me IV treatments if I go to St. Clair's? Well, Mr. Finnerty, they actually don't usually do that in hospice. You know, as people get closer to death, experience tells people in hospice that it's actually a little bit better to be a little on the dry side. Patients just cough more with too much fluid. But what about today? Well, can't you just drink some more salty fluids like soup? Nothing staying down, Doc. Well, you know, you are still dehydrated. In fact, it was hard to tell how much his drop in blood pressure upon rising from bed was due to deconditioning and how much from dehydration. He had, in my judgment, taken to bed much earlier than he needed to. He had, it seemed to me, many acquaintances, but it was really hard to tell if he had any close friends. I gradually learned that he had been estranged from quite a few members of his family. One of his cousins, a priest, had accused him of murdering his mother by not authorizing the use of a feeding tube as she was dying of Alzheimer's. He stated that he was close to a few nephews, but it seems that this was a source of strain in his relationship with their parents. He was a frequent AA sponsor, and some of his fellow alcoholics visited him as well. So, I guess we can give you some normal saline by vein. I'll check with the nursing agency, but this is no substitute for that good old chicken soup. I want you to keep up with your fluids and eat as much as you can. So began a ritual of twice weekly normal saline infusions. Even when we'd finally succeeded in controlling his nausea, he still kept insisting on these saline infusions. From a purely biomedical point of view, I think these infusions were superfluous. From another point of view, however, you might say they were grossly inadequate. I simply came to regard them as a kind of placebo that seemed to help him. A week later, I received a call. I think I'm dying. Okay, Mr. Finnerty, easy now. Tell me what's bothering you. I got more pain in my shoulder, and I'm nauseous again, and my stomach hurts, and I ain't had a bowel movement in 3 days. Easy, Mr. Finnerty, easy. Has the nurse been in today? Not yet. Are you taking the Senecot? No, I thought I could just get by with the Colace. And what about that Tylenol number 3? I don't want to. I'm an addict, you know. Mr. Finnerty, easy now. I think we can take care of this. I'll order some pain medications. You're not going to get addicted, and you're not going to be a martyr. Listen to me. I'll give you an enema. We'll get some pain medication. We'll start you back on the Senecot. And you need to keep taking that ondansetron as well. And if that's not enough, I'm going to order a suppository for your nausea. It's going to be okay. You mean I'm not dying? Certainly not today. How do you know that? Well, because people who are dying usually aren't well enough to call their doctors on the phone to tell them that they're dying. Every problem you've got is fixable. Well, when then? Not today. Well, what about St. Clair's? I heard you're number 2 on the list. Hey, that's kind of morbid, ain't it, Doc? Waiting for people to die? All right, I'll give them a call. Hey, can I have your BEPA number? I mean, I won't abuse it or nothing. I just want it in case I can't get you otherwise. Sure, Mr. Finnerty, sure. In total, I made 5 home visits. As much as I urged him to get up out of bed, I never found him anywhere else but in bed when I arrived. The apartment was well lived in, filled with statues and pictures of saints. He had a book for reciting the prayers of the Liturgy of the Hours, something generally only used by priests, sisters, and brothers, right at his bedside. His rosary beads were never far away. Most of the time he had them wrapped around his right hand. He was blessed with an exceptional cadre of nurses and home attendants. The attendants kept trying to get him to roll over and lay on his side to prevent bed sores. He was not very compliant. They were all young Mexican women and at least as pious as him. They also made great chicken soup. "I'm afraid I'm going to be damned," he said to me one day, his eyes again straining out of their sockets. "Well, you've received the sacrament of the sick and you've confessed, haven't you?" "Yeah, but I'm still afraid, Doc. I'm still afraid." "Mr. Finnerty, you need to believe in your heart what you profess with your lips. I believe God loves you, don't you? I don't believe God wants you damned." What did this guy want from me? After all, I have to confess, I really didn't like him. He would not have been my first choice for a drinking buddy. I didn't like the sound of his voice, but I especially didn't like his neediness. It was a really busy time for me with grant deadlines and writing assignments and speaking engagements. And every time I went away, I left complicated instructions for him about how he could get me while I was on the road. In truth, he never once abused the privilege of having my beeper. But I'll tell you, I hadn't given my beeper number out to a patient in years, perhaps because none had been as nervy as Fred to ask for it. Nor was I in the regular business of making home visits. Home visits aren't easy to fit into a physician's schedule these days. I figured out that the simplest way for me to do this was to do them first thing in the morning. I'd go to his apartment by subway on my way to work. That way I could do the whole task in about 75 minutes, including the visit itself and the extra travel time to get to my office at the hospital. I brought a medical student with me one day. She had never seen a doctor make a home visit. The visits to Mr. Finnerty's apartment were at least somewhat helpful medically, but I could have easily relied upon the nurses' assessments without ever visiting. They were really excellent, excellent nurses. They had extraordinary patience with him. When he demanded a special air-cushioned bed and they tried to explain to him that his insurance wouldn't pay for it because he had no bed sores, his primary nurse, Tom, dutifully called me, explaining to Mr. Finnerty that he didn't think the chair of the ethics department was going to lie in order to get his patient the insurance coverage to pay for it. Each visit was difficult to conclude. I couldn't, since I was on his turf, rely on the rattling sound of the chart of the next patient being placed in the slot in the door as a convenient prompt for me to suggest that the visit must come to an end. That only works when you're in the office. Mr. Finnerty especially loved talking to me about church gossip. Who would be the next Archbishop of New York? What did I think of bishops denying communion to Catholic politicians who supported abortion? One of the times I was out of town during the time I cared for him, it was, of all things, to give a talk on spirituality and healthcare. And as part of this workshop, I had asked the participating physicians to spend 10 minutes thinking about just one patient. It's something I do fairly regularly at workshops for physicians. It's a useful exercise. It is often extremely difficult for physicians to do this, to spend 10 minutes thinking about one patient. Studies have shown that even when the patient is present and starting to say what's wrong, physicians on average interrupt within 18 seconds. Now, as a gesture of solidarity, when I ask my colleagues to do this exercise, I participate myself. And on this occasion, not surprisingly, it was Mr. Finnerty who occupied my meditation. Within a few moments, my meditation had turned into a litany. I could see his face, and I could hear his voice. And I prayed to myself, Lord, have mercy on Fred. Fred, have mercy on Fred. Lord, have mercy on Fred. Over and over. Although he was never exactly cheery, his mood gradually became much bluer. I began to think that in retrospect, perhaps even his reluctance to get out of bed might have been a sign of depression that I'd been overlooking all along. Do you think you might be depressed? I asked. I think I am, he replied. Have you ever been depressed before? Well, when my lover died 25 years ago, I was really bad. They put me on some medicine. Do you remember what it was? It was too long ago, Dr. Sulmasy. Now, I have to say, it's always been a puzzle to me how it is that so very many gay people reconcile themselves to the church and its teachings, live lives that often directly violate church teachings about homosexuality, and yet are so obviously traditional and devotional in their religious practices. To inquire, though, would have seemed more curiosity on my part and probably not helpful. Perhaps I would stir up too much that had long ago been buried. Such a discussion now might even be harmful. Better to leave it to the mysteries that only God knows. So I decided I wasn't going to probe too much. Don't ask, just serve. Maybe that's as good a policy as there is for a physician. I simply prescribed some paroxetine. Since he lived alone and was fixed in the idea of going to an inpatient hospice, we had never applied for home hospice. He had decided that the regular home nursing care program would be good enough as a bridge to hospice. In fact, it was more than good enough, because 11 weeks after stopping his Darceva and having immediately put him on the list at St. Clair's, he still hadn't been admitted to that hospice. Waiting times in the U.S. for inpatient hospice can be extraordinarily long. Most of his best hospice time was spent playing that morbid game of waiting for other people to die. On the other hand, he really had hospice without the name. The home care nurses who attended him were wonderful, and his aides, that cadre of young Latinas, were strong and joyful, delightful and caring. He had very little pain through most of the course of his illness. He never did develop a bedsore despite his early trouble with diarrhea and the fact that he infrequently left the bed. But he did begin to lose weight. His appetite remained quite poor. And through it all, though, he could still read the papers, pray the rosary, and tell people what to do. In examining him one day, I found that he was free of jaundice. His lungs remained clear. His liver was only mildly enlarged. But I felt a new right supraclavicular node. And with my fingers lingering there for just a few seconds to confirm the finding, he felt me feeling it. What'd you find? A lymph node, Mr. Finnerty. That means I ain't got much time left? I don't know that it means that. I mean, it does mean that the cancer is growing, but you probably didn't need me to tell you that. Do you mean it's going to go to my brain? No, I don't think it means that. 2 weeks later, at the end of February, things did suddenly change. He began to complain of more pain in his shoulder and in his abdomen. Up until this time, Tylenol number 3 had been sufficient. Now we changed over to hydromorphone since he'd had some in the house. He called my office one morning and sounded a bit confused, and the aides began to panic. I called and asked his nurse, Tom, to see him and let me know what he thought. I think he's dying, Dr. Sulmasy. Well, maybe we need to start a morphine drip. I know he has a Heplock in place, so we can just hook him up. But it's Friday afternoon. The home infusion team is going to be tough to mobilize. Can he still take pain medicines by mouth? I don't know, let me see, Tom replied. Well, maybe if I crush the hydromorphone and put it in some pudding, I can get him to take it. He called a few minutes later to report that that had worked. Later, I spoke with the supervisor for the home care nursing team. Doctor, we need a plan for the weekend, she said. So I'm with you. I'm just trying to sketch out a plan myself. The IV home infusion team had confirmed that they would not be able to start intravenous morphine until Monday. The home health aides were not legally authorized to give injections, so subcutaneous morphine was out. And the smallest fentanyl patch available was still a bit too potent, given how little pain medicine he'd been requiring. And the supervisor for the nurses tried calling pharmacies, and none of them stocked morphine or hydromorphone in suppository form. Said, I'm an old hospice nurse, though, she said to me, and so is the nurse covering for Tom over the weekend. We'll just make our own suppository out of crushed pills if he can't take the medicine by mouth. A deal, I replied, and I'm around all weekend. I'll keep my beeper on, and I'll certainly be willing to sign the death certificate. I visited him for the last time that night. I needed a complex plan just to get to his apartment. I was scheduled to drive to Long Island for an overnight day of recollection with my local friar community at a small retreat place. Further, I had promised a young friar who had just started chemotherapy for acute lymphoblastic leukemia at a nearby major cancer center that I would visit him that night. And I also realized that I had left my cell phone at home at the friary, and I wanted to have it with me while I was on retreat in case I was out walking and someone called about Fred. And of course, they were predicting a big snowstorm. In the end, my plan was simple. Go steadily north before heading east. So accordingly, my first stop was Fred's apartment. I parked illegally to save some time, hoping I wouldn't get caught by the NYPD. I didn't bring my stethoscope or my prescription pad. One of the young Mexican girls answered the door. "He just take the morphina," she said. "Good," I answered. He was lying in bed, as always, the rosary beads wrapped around his right hand. The, quote, New York State out of hospital do not resuscitate order, unquote, form was clipped to the bedboard. I had helped him to fill it out months ago. I knew it was the correct thing to do, yet now it seemed intrusive and awkward, almost a desecration. "Mr. Finnerty, it's Dr. Sulmasy. Are you doing okay? Are you comfortable?" He opened his mouth, but he didn't speak. He raised his head for a few seconds and opened his eyes, and then he closed them again as his head fell back gently upon the pillow. He was breathing about 20 times a minute. His pulse wasn't palpable at the wrist, but as I touched his abdomen to make sure he wasn't in pain, I could feel his abdominal aorta. It was beating forcefully. The rate was probably 120. I didn't bother to count. His right leg was bent at the knee, raised up off the bed and trembling. And I gently touched his knee and eased it down. And the aide positioned a pillow underneath his left leg so that his right ankle would rest upon it as well. "Easy, Fred. I think you're going to feel better this way." And a mild look of strain disappeared from his face, melting into the peace of the morphina. And I held his hand and I prayed. Time for night prayer, Fred. Protect us, Lord, as we stay awake. Watch over us as we sleep, that awake we might keep watch with Christ, and asleep rest in his peace. Lord, now you let your servant go according to your word in peace. For my own eyes have seen the salvation which you have promised in the sight of every people, a light to reveal you to the Gentiles, the glory of your people Israel. Glory to the Father, and the Son, and the Holy Spirit, as it was in the beginning, is now, and will be forever. Amen. May the all-powerful Lord grant us a restful night and a peaceful death. Good night, Fred. I turned to a young man who had been sitting silently in a chair in one corner of the room. His bare arms were heavily tattooed. Maybe it was one of his nephews, maybe an alcoholic he'd sponsored at AA, I wasn't sure. I just said, "It's good that you're here. Stay with him." And I left the apartment. Now, within a few moments, I found myself driving up to the cancer center to visit that young friar, John, who had recently started chemotherapy for leukemia. And as the headlights rolled past on the opposite side of the highway, I began to feel as if somebody else was doing the driving. I was merely going along for the ride. I headed north in the darkness, vaguely conscious of the river to my right, vaguely conscious of my visit with Fred behind me. And yet I couldn't avoid asking myself yet a new question. Why John? Or rather, I was asking God, why all the good, young, energetic, healthy friars? And the shift from Fred to John felt like a film editor's mistake. The scene had changed, but the scene was from another movie. And I was spliced into both scenes, playing this supporting role. You see, another good, young, energetic friar from our province had been recently diagnosed before that with multiple myeloma. We were barely past the shock and the pain of that diagnosis when we learned that John had leukemia. Don't you realize how strapped we are for vocations, Lord? How we're pulling out of our commitments to parishes and other places because we don't have enough friars? So much for my theological sophistication, I thought to myself. But in the end, these sorts of questions can't be explained away by ratiocinations. They come from the lung, not the cerebral cortex. I wondered how John would really do. His prognosis was really not very good. I wondered whether the time would come when my visits to John would become like my visits to Fred. The alpha and the omega of cancer treatment, all within this 90-minute span. Was this some kind of avant-garde movie I was living in? And as I continued driving up the highway towards the cancer center, I also remembered that I needed to go to the friary to pick up my cell phone. And I was fearful I might forget this task and just drive out to Long Island immediately after seeing John. So even before I reached the cancer center, I was reminding myself to remember. After all, I was still planning to take my usual walk along the beach the following morning. And I would carry my beeper, but I also needed to have my phone. They might call about Fred while I was out walking and praying, and it would be best to be prepared because it could happen at any time. In the end, my geographic plan seemed to work. I visited John, I drove to the friary, picked up my phone, I drove out to Long Island to the retreat place at the beach, and I beat the snowstorm. Very efficient, just like a doc. Now, one of the friars with whom I lived had gone to the retreat house earlier in the day. He'd prepared a late dinner for the two of us. It was a Friday in Lent, so we ate fish. Sole stuffed with crab meat, hardly penitential, but we had a nice dinner. I said nothing to him about Fred. I barely mentioned that I had seen John and that he was doing okay. We had a lively conversation that I actually found pleasantly distracting. Before I knew it, it was 11, so I washed the dishes, picked out one of the guest rooms, and prepared to go to bed. The snowstorm that they had predicted on the weather forecast never did arrive. In its place came a torrential, windswept rain, blown in off the ocean, beating with a rhythmic tapping against the northeast window of my room. No snow, no sleet, no winter lightning, just the rain. I charged my cell phone. I placed my beeper on the nightstand next to the bed. I was waiting for the call. It might well come during the night. And I rehearsed to myself how I would instruct the nurses in the family, bring a note of calm, and finally bring Fred's story to a close. Whatever else he wanted from me, he seemed to want me to be there for this final step of his journey, and I was determined to see it through to the end. I didn't use a prayer book this night. I was tired. So I prayed the Canticle of Simeon to myself once more this night from memory. Night prayer again, this time for me. And I fell asleep. I awoke the next morning at 6:30 in the grayness of a cloudy sunrise before the alarm. And I was seized by this sudden sense of panic. The rain was much softer, but it hadn't stopped. I never changed my beeper signal from vibrate to alarm, I thought to myself. What if it went off and I didn't hear? I fumbled for my glasses and pressed the message button on the beeper. Urgent, 3:42 a.m. EST, it read. And I pressed it again. Urgent, 3:35 a.m. EST. Shit. I shook the fogginess out of my head. I rubbed the sleep from my eyes, reached for the phone, and dialed the callback number. A woman answered with a voice so cheerful that it jarred me. I began to mumble, I suspect you must be the nurse who was covering for Mr. Finnerty over the weekend. I'm really sorry. I just woke up and realized that you'd paged me in the middle of the night. You know, I'm really sorry. I put the beeper on the nightstand next to the bed, but I forgot to turn it from vibrate to alarm. I said I'd be available day or night. I'm sorry. No problem, she said. And it dawned for me that her cheeriness meant she'd been up most of the night and hadn't gone to bed. I got through to the covering internist, Dr. Weinstein, and he took care of everything. He was very pleasant and cooperative. Mr. Finnerty's death was really quite peaceful. Family and friends were there with him. It all went very smoothly. The funeral parlor will call you on Mondays, and you'll have to sign the death certificate. Oh, you know, at least thank you. It's good to hear that much. Again, thank you so much. I'm sorry. Oh, not a problem. It was a pleasure to care for him. Now, if you excuse me, I'm going to bed. And she hung up. The showers were now alternating with hints of sun. I looked out the window and saw a small patch of blue amid the lessening gray. I knew that the rain would eventually stop and that I'd be able to get my walk in on the beach after all. The weather cleared, and I did get to the beach. I walked along the ocean for miles. The salt air and the sound of the waves seemed just right. But as I walked, I couldn't stop thinking about Fred. Every once in a while, I stopped walking, turned away from the beach, and looked out at the wide, storm-stirred ocean, seemingly endless in its expanse. Myriads of sunbeams were striking the surface and dancing a brilliant and angelic ballet. You know, at such times, the ocean can seem infinite. But I knew it was not infinite. I could see the horizon. And horizons enclose us in the finite. Even this massive ocean, I thought, even this Atlantic Ocean was finite. See, Fred had demanded salt and water. But even the depths of this ocean would not have supplied enough saline for Fred. He so desperately needed the salt of the earth. if we could have infused all of the saline in all of the oceans, in all of the world into his veins, it would not have been enough for Fred. Maybe it will never be enough for any of us. I prayed that Fred's needs were now fulfilled, that all the neediness I saw in him and knew that I could not fulfill had somehow now been fulfilled. And I began to thank Fred now for all he had taught me about my own needs and about my own insufficiency. I sensed, too, somehow that I wasn't alone. When I looked around, I couldn't see a soul, but I had this sense that I wasn't alone. Not now in my walking, not then whenever I had visited Fred or seen him in my office or in the hospital. Had Fred ever seen who was with me? I wasn't sure. But I finally realized as I walked along the beach and prayed that it had not been me that Fred had been looking for after all. Not ever. Never. You see, each time he asked me for something, or he asked anyone who cared for him for anything, a sleeping pill, a hospital bed, an enema, another infusion of saline, he was really looking for someone else. Had he noticed? I knew that I had not noticed, at least not until this moment. See, I had thought all along that Fred was looking for me with those pleading eyes and his plaintive voice. And I had quietly resented his calls because I knew that I could not fulfill his needs. I saw it all differently then, at least at that moment, walking on the beach after the rain. The beach had been deserted all morning. It was cold and windy. The rain had only just stopped. But as I walked further down the wet sand, I finally did see someone else, another crazy person who had sought out the solace of the beach in winter. Far up ahead, standing by a fire at the edge of the foamy waves, I saw the outlines of a man. The image was indistinct, but he was warming his hands over a fire. I wondered if Fred could see him now better than I could. The vision of the dead is sharper than the vision of the living, or so they say. As I drew closer, I could make out his wading boots and his tackle. A surf caster, I thought, as I watched him toss his line out into the sea. Smart guy. First on the beach. The fish are always more abundant after the rain. Did Fred see him too? I hoped he did. I smiled, looked at my watch, and realized it was getting late. I turned around and headed back down the beach toward the retreat house. The friars were expecting me for midday prayers.